Have you ever looked at the mirror and wondered for a more youthful and radiant complexion? Hi, I'm Dr. Angeline Yong, board-certified dermatologist, and today we're going to deep dive into the world of cosmetic dermatology and how we can use it to enhance your appearance naturally. Cosmetic dermatology focuses on enhancing or improving the appearance of your skin, hair, and nails. It is about enhancing your natural beauty and restoring your youthful appearance without creating a completely different look. At the same time, as a board-certified dermatologist, we also focus on the medical health of the skin. Hence, any treatments that we deploy as a dermatologist subspecializing in the field of cosmetic dermatology, we will want to support and not take away from the underlying health of the skin. So any treatments should be supportive, taking into account whether you have underlying sensitive skin type like eczema, rosacea, or even acne-prone skin, or even other more complex underlying medical skin conditions, and then choose the appropriate treatments that are tailored to your specific individual needs. So moving up the ladder, we start at the bottom, and that can include very basic treatments such as medical grade facials, chemical peels, electroporation, to name a few. So these treatments all work together to improve your skin health very synergistically. So for example, electroporation can be used to enhance penetration of certain products. We can use it to improve hydration of the skin, for example. Chemical peels can be very useful to brighten the skin, improving pigmentation disorders, as well as improving acne-prone skin. So what it does is by eliminating dead skin cells and encouraging cell cycle turnover, and hence pushing blemishes out to the surface. So moving up the ladder from skin health monthly treatments, we can look at things in the light and laser technology spectrum. So in light technology, for example, simply put, there are things such as LED devices that we can use in clinic that are more powerful. For example, blue light can be used once or twice a week to kill bacteria that causes acne, and hence can be useful for acne-prone patients. We also have red light or far infrared technology that's very good for remodeling the skin, for improving your cell metabolism, and hence really helps with the anti-aging aspect as well. Now, moving to laser technology, one of my favorite spectrums, because I really like to deploy various lasers in my practice, would be that lasers really run the gamut. So you can have very short pulse duration lasers such as a picosecond lasers in various wavelengths, and they can be used to treat typically pigmentary disorders. So it can be used to treat dull skin tone, hyperpigmentation, like from the epidermal down to dermal pigmentation such as freckles, sunspots, a lot of dyschromia in the skin, as well as even melasma. At the same time, these picosecond lasers are also very useful in a certain format to treat scars as well as pores and rhytids, because it has a non-ablative fractional remodeling component that can be used to improve skin texture as well without the same downtime that ablative lasers cause. So then we move to the ablative lasers such as fractional CO2 or erbium lasers, and these are really useful not just for treating scarring conditions of the skin such as acne scars or surgical scars, but can be useful especially in the higher skin phototypes like from type 1 to type 3. Various skin tone complexions can really deploy some of these ablative technologies to refresh the skin once every 6 months or once every year to reduce photo damage in the skin and also improve fine lines and wrinkles. We also have non-ablative fractional remodeling devices. I mentioned the pico lasers earlier on, but there are other energy platforms such as the erbium glass, and these are actually technologies that help to also improve the skin quality, tighten the skin, refresh acne scars without causing the same downtime that ablative lasers do. And then of course we have other lasers that target the reds in the skin. So we have the vascular lasers, and I use something like a pulse dye laser, for example, very useful for treating things like telangiectasias, unwanted cherryangiomas, and also treating conditions such as rosacea in the skin to decrease the redness in the skin, and also pesky post-inflammatory erythema, for example, caused by acne scarring. And then we move on to long pulse lasers, which famously can be used to treat and remove unwanted facial and body hair. We can also use it for photo rejuvenation as well. It can be used for laser tightening. And there you have it, a whole range of different laser technology, and just to name a few different subgroups or families that we can choose from individually for certain patients, but also synergistically in a combination to treat various aspects of the skin. So there you have it. We just talked about light and laser energy platforms. We move on to the other big group, what I group under energy-based devices. To name a few, they will be divided into technologies like radio frequency, ultrasound technology, and even microneedle radio frequency. For example, let's talk about radio frequency. Very useful energy-based platform that uses radio frequency energy to tighten the skin, improve the tightening of collagen bundles, and hence create a lift in the skin as well. very useful for certain areas like the periorbital skin, even the face and the neck area to tighten, and this can be done monthly to create a more refreshed, youthful look. We can also use it or deploy it in other areas like the inner arm where there's laxity, or even the abdomen, just to name a few areas. Now, ultrasound technology is again another energy-based platform that can be used for tightening as well. So this is using ultrasound technology delivered in the form of high-intensity focused ultrasound or collimated beams like soft wave to create collagen remodeling. This helps to create a tightened, more refreshed look, what we call a non-surgical facelift, and hence can be done once every 6 months or once every year depending on the technology deployed. We also have combination technologies like microneedle radiofrequency. So think about it as a hybrid between microneedling as well as radiofrequency. So all these tips of microneedles deliver radiofrequency at their end, and this can be used deep to create lifting as well, and can also be used on the surface to create improvement in fine lines, rhytids, and pores. So you have a very holistic improvement with microneedle radiofrequency that can improve not just skin texture but also create a lifting and tightening effect as well. Next, we can consider other treatments such as injectable category. Now, under injectable categories, I like to subdivide them into the botulinum toxin family as well as the other injectables like your skin fillers. So let's talk about botulinum toxin first. So this is commonly used to really treat dynamic rhytids, especially in the upper face like the forehead, your number 11s, what we call the glabellar rhytids, and your crow's feet area. But also has a lot of other indications. Sometimes we use it for nose slimming, for nasal tip elevation, even for pebbly chin, for platysmal bands, which helps to create a nice refreshed contour on your jawline. We also can use it in other areas of the body, such as for hyperhidrosis, and even for treating things such as pores by using a toxin technique called microbotulinum toxin. Next, we have the whole family of dermal filler options, and the most famous or well-known would be hyaluronic acid injectables. So HA can come from different brands and can have different molecular weights. We have the very low molecular weight HAs, typically things we call skin boosters, that can be deposited as micro droplets in the skin to bind more water. So it improves skin hydration, reduces transepidermal water loss, overall improves the skin health by making it more radiant and more hydrated. On the other hand, we also have higher molecular weight fillers or injectables that are used for volumization. For example, if you have hollowing in the temples or you have fat loss in the cheeks due to age-related process, your HA injectables can be used to volumize these areas naturally and not overdoing it, of course. It can also be used to naturally enhance your beauty. For example, if you find that you want to improve your lip contour or improve your chin projection, certain HA injectables of different molecular weights can be placed suitably in these areas to enhance your appearance naturally. We also have biostimulatory injectables. So this is a different category that doesn't utilize HA, but uses certain biostimulatory molecules like calcium hydroxy apatite or PLLA to name a few. And these molecules are put into the skin and it helps to create collagen remodeling by encouraging your own body's fibroblasts to create collagen. And this happens over a period of 1 to 3 months, and then over time you get a skin tightening improvement process and hence a very natural improvement that doesn't look over volumized as well. We also have other categories of injectables, for example, like your polynucleotides or your PDRN as well, that can be utilized to improve the skin DNA and RNA repair processes and hence improve certain age-related processes like pores, rhytids, and make the skin more radiant and overall glass skin sort of appearance. So there you have it, a list of different types of injectables that your dermatologist can come together and put together various combinations to improve different levels or different depths of your skin. This video is not meant to be exhaustive, but to be informative of the various subgroups of treatments that we have available today. So the bigger range or a broader toolkit that your dermatologist has, the better they are equipped to tailor to your individual needs. So taking into account not just gender, sometimes preferences in lifestyle, as well as certain individual beliefs in what they prefer, a natural enhancement versus a bit more invasive treatments or in combination, but also taking into account individual medical skin conditions, for example, like sensitive skin types like rosacea and eczema have to be also taken into account for, and hence going to a right practitioner that is not just board certified and trained in the biology of the skin and understands the anatomy and structure of age-related processes, but also somebody that has a wide repertoire is important, because this then allows you to have a toolkit that is available to tailor to your own needs and also to better enhance different layers of your skin. If you like this video, don't forget to like and subscribe to our channel for more interesting dermatological content.